Hi, good evening. This is Tally. I'm the editor for First Aid for the Boards. Welcome to our talk tonight, Secrets of the USMLE, How to Dissect Any Question on Test Day. We have a very special edition tonight. This is our communications question dissection. As you know, the USMLE is introducing these new questions. They've been out probably for a couple months, and you're going to see more of them as the year wears on. So again, we'll get going, on this. So again, my name is Telly. I'm an assistant associate clinical professor of allergy immunology at the University of Louisville, with First Aid and also with USMLE-Rx and ScholarRx. Tonight, our primary presenter is none other than our famous Rx coach, Pras from UT Southwestern. Pras, you want to introduce yourself?
Sure, thank you, Dr. Lee. Hey everyone, my name is Paris. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I've worked with USMLE-Rx as an Rx coach for more than a year now, working primarily with students one-on-one to help them prepare for the USMLE Step 1.
Great, and we have two additional coaches here tonight that will be taking questions and answers in the question and answer panel. I'll show you where that is shortly. Sean, do you want to introduce yourself?
Hello everybody, Sean Nanji here, also with RX Coach, our tutoring and coaching initiative. I look forward to answering your questions and an exciting new webinar on communications tonight. So happy to be here.
All right, and we also have Kasha. Kasha.
All right, good evening everybody. My name is Kasha Bornstein. I'm a fourth year MD MPH student at the University of Miami. Hopefully I'm emergency medicine bound. And I've been working with RX Coach for almost a year now, with students working towards meeting their goals and achieving success on the USMLE Step 1 and Step 2. Pleasure to be here. I'm excited to answer your questions.
All right. So throughout the question dissections, our RX coaches are here to answer your questions. And the way you can do that is in the control panel. If you're on a PC, and I think Macs as well too, there's a control panel towards the right side. Within the control panel, there should be a panel that says questions, and in there you should be able to ask questions. And then one of our coaches will do their best to give you advice. And tonight's mostly quick Q&A, that type of stuff. If you want something more in depth, we highly advise that you reach out to our RX coaches for a free consultation. I'll show you how you can do that a little later. Where you can get more advice and see if there's anything else the coaches can do to help you, achieve your goals on USMLE, in your classwork, or anything else. All right, very good. So with that, let's get going here. So in our agenda, as I mentioned, we'll do we've gone through the introductions. We'll talk a little bit about some of the USMLE changes. Some of it's COVID related, some is just blueprint related. We'll talk about our RX bricks and how they can help you prepare for the USMLE. We'll talk about our approach to questions. Paras will go through this in detail. Paras will also lead a number of question dissections. We'll finish up with some advice, and then we'll have a raffle and a special offer. So you stick around. The raffle does include 5 coaching sessions and access to RX 360 Plus, which includes our question bank, our top tier question bank, all of our bricks, our education bricks, digital first aid, digital flashcards, and digital videos, really the complete package for Step 1 prep. And then, as I mentioned, there will be a special offer as well too, and then we'll open it up for Q&A at the very end. All right. But you got to stick around if and hopefully we'll call you out. As I mentioned, there are some changes. Everyone I think is aware of by now of USMLE going pass fail. It is still on track to be implemented by early next year, and you're also aware that Step 2 CS was suspended, and they'll probably think about reintroducing it, in the next year or so. They'll give us some dates by, early this year, and we'll see how it shakes out. And if you are graduating, at some point, they will ask you to make up that requirement somewhere in residency. That's what we think is going to happen. We'll obviously see, when the when the parameters and guidelines come out. Again, with USMLE content distribution changes, the big news is obviously these new patient communication questions that were introduced to the USMLE blueprint. They are now available as well too in our question bank. We have close to 30, but we have more on the way to help you prepare for this critical section on the USMLE Step 1. And then the last thing is that there are some pharmacology changes to Step 1. So there will continue to be a focus on mechanisms, maybe adverse events, but not on pharmacotherapy. So specific treatments and stuff like that is going to be moved to Step 2 CK. All right. So if you look at the blueprint, what you'll see is that the bulk of this is on medical knowledge. Some diagnosis, but really no patient management. And you're seeing for the first time a significant bump in the communications interpersonal skills, along with the existing praxis-based learning and improvement. Before I go any further, I do want to ask the question, now that I've covered a little bit of information about USMLE and some of the changes to the blueprints. I want to ask, I want to ask a little bit about who you are in the audience. So I'm going to launch this poll question here. I want to know if you're a U.S. student, allopathic, osteopathic, if you're an international medical student, either foreign-born or U.S. So I just want to see who is out there tonight. So I'm going to leave this open for about 20 seconds, because it does take a little bit of time to collect and collate the responses. So looks like about a third of you have voted. It's rapidly climbing. We're close to 50% now, and we're close to 2/3. And couple more seconds. Okay, great. We're about 3/4. So I'm going to close this. Getting some notes that people are logging in from all kinds of places, all kinds of areas around the world. If you want to shout out where you're at in the question box, we'd love to know where you're at. And as you can see, this looks to be a very global audience that we're speaking to tonight. Fully 2/3 of you are born internationally. Some are U.S. citizens, but also going international. And then obviously there are obviously some North American folks on tonight as well too. So glad to have you here. I'm seeing in the question box people from India, Ghana, Tennessee. That's not too far from me. Panama, Mexico, Honduras, Nepal. Yeah, it's a great crowd tonight. So really welcome guys and gals, and hopefully, some more Americans, Georgia, Florida, Texas, Puerto Rico, Germany, Jordan. So yeah, really international group tonight. So welcome everybody. All right, I want to ask another Brooklyn. That sometimes feels a little, strange as well. Anyway, okay, I have another question for you. Let me hide this, and then I am, a couple people from Puerto Rico, huh? All right, when are you taking the Step 1? Hungary, I'm seeing Hungary, Poland. All right, I'm going to launch another question here. When do you plan to take this Step 1? Is it anytime soon or later? All right, I'll let you guys answer that. That's going to, again, take 20 seconds or 30 seconds. Let's see. While I'm going to kind of look through this list of folks. We got people from Egypt, St. Lucia, Cuba. Always wanted to go to Cuba, actually. Here's a wonderful place. Czech Republic, Doha. I'll have to look that up. I'm not exactly sure where Doha is. DC. All right, we got about 70% of you have answered. All right. I'm going to go ahead and close the poll. I'm going to share the response here. And what we see here is the bulk of you folks are going to be taking it April through June, and then the rest of you guys are scattered throughout the year. All right. Excellent. Let's keep going here. All right, so I'm gonna minimize my control panel so I can see my slides here. All right, so on the USMLE, again, many of you already know this. It's mostly one best answer items. Actually, it's all one best answer items. Some of them do have multimedia. The vast majority of them are case-based vignettes, and they often have multi-step reasoning, right? Or you know, what you often hear is a second order, third order. So they tie multiple concepts together. And on the step one, there's more of an emphasis on the basic science, the mechanism of disease, and so forth. As you saw in the blueprint, there is some diagnosis, but very little management. The diagnosis and management, you see more of that in USMLE Step 2 CK and Step 3. All right, so I said a little earlier that bricks, you know, our curriculum bricks are a wonderful way to get a basic understanding, learning of these issues before you go into heavy duty test prep. So I'll show you an example of that. And so, you know, as you can see here, you can log in and actually get free access to all of our biochemistry and microbiology group. That's our contribution to all of you. So it's going to be, you know, essentially, you know, free indefinitely. So take advantage of them while they're out there. And so, but you know, if you subscribe to them, you get access to close to 800 bricks, covering everything in preclinical science. And then there's also these community bricks. And it so happens in the community bricks, we have certain bricks on sexual and reproductive health rights. And, you know, some of these issues can, as you imagine, be sensitive or challenging, and can often show up in patient communications type questions. So like, for example, questions with regards to how you address somebody's gender identity, sexual orientation, you know, how do you, how do you discuss it with them in a way that's sensitive and respects, you know, their autonomy and so forth. And so these are types of situations that can show up on the USMLE Step 1, right? And so check out these bricks. And these bricks, by the way, are free as well too. Anything that we're doing in the community bricks are free for the world. And this is through our Message Alliance. This is our Medical Student Alliance for Global Education. This is where student leaders from around the world are developing curriculum that we and are working with us to share with the world. I'll also show you that, you know, our bricks are quite in depth but at the same time very approachable. Here's another brick about heart murmur, auscultation. So very similar to what you saw with the sexual identity brick, but you'll also notice that we have these case connections that allow you to apply everything you learn into a clinically relevant context. You know, so it not only will help you for the boards, but it just helps you become a better doctor, right? Because you're always trying to figure out how do you use this information today. And you'll also notice that our bricks are richly, you know, illustrated and very interactive. So you'll notice that, you know, not only do we have beautiful illustrations, but you can, you know, magnify them, and you can also quizify these as well too. So you'll notice that all the labels have been hidden, but then you want to mouse over and say, hey, look, is this the right ventricle? Oh yeah, it is. Is this the, you know, the left ventricle here? Yeah, it is. Is this the superior vena cava? No, it's the IVC, right? So it's very, very powerful for self-assessment and, you know, and your continued learning through active learning, active quizzing, as opposed to just passively watching a video or just passively reading a text and zoning out, right? And you'll notice that, you know, we use multimedia where we think is appropriate, right? So if you click here, you should be able to hear potentially through the webinar, maybe not, you know, the crescendo, decrescendo of the aortic stenosis murmur, which has an early crescendo, and versus the late crescendo of the aortic regurgitation murmur. So you can experience that in its multimedia audio glory. And you'll notice as you go through, there are quiz checks everywhere, right? Even the mnemonics are quiz checks, right? You know, in terms of using a mnemonic for identifying all the areas of the heart, right? And then being able to do flashcards, you know, tied to all the key learning concepts, you know, in the bricks, right? And then when you get to the very end, you can get a summary of the key points in that brick, you know, that are high yield. And then we also close out the case and give you a proper response based on the concepts that were covered in that brick. So now not only have you learned the concepts, but now you actually know how it gets used in real life, right? Especially if you haven't had much patient experience yet, right? And then we have multiple choice questions with specific feedback at the end, and then on top of that, you can then further explore these topics with high yield reviews, like going into first aid, right? So with one click, this will take you into first aid. And in first aid, once it shows up, you will be able to highlight, annotate. As you can see here, I've already done this already. You can navigate to other parts of the book here, by just clicking on any of these topics. And then when you're done, it'll take you right back to the brick where you started from. And you can, go even further with other high yield review, including doing QMAX questions, so high yield step 1 questions, high yield flashcards, 67 flashcards that we curate for you, and also our express videos as well too. So a high yield video review. So lots of high yield, prep review in addition to the primary learning that you're doing in our bricks. One of our newest features that I'm very excited to show you is that we have developed interactive illustrations as well too. So I think this is going to take a second to upload here, but once it's uploaded, I'll show you how it looks. What you'll notice here is what looks like a regular image, right? Cross-sectional CT, right? But you'll notice, like in textbooks, this is probably all you'll get, and you're always wondering, well, where is exactly the borders of the left lung, or where is exactly is the pleural effusion? If you mouse over it, you'll see that everything gets highlighted in full color. So now you have a better idea of where all these structures are, right? And then if you actually, go into quiz mode here, it gets even better. Now you're actually given the naked image, right? Exactly how you would see if you walk into a radiology reading room, and then the attending asks you to point to the pleural effusion. You can then just mouse over and see if that is, and say, well, is the pleural effusion here? No, it's not. Here's the heart. Here's the dilated bronchi. Here's the pleural effusion right down here, and you can see it clearly delineated, in the right part of the chest. Okay, so this is one of our new tools. Again, makes it a very powerful learning experience, much better than just watching a bunch of videos passively and not being challenged and tested, as you go along. Alrighty, and you can see here's another example as well too, and where you can see the signet rings that's tied to the dilated bronchi. All right, so that's a quick whirlwind tour through the bricks and how they can help you get set up for your test prep and your question dissection. All righty, so getting back here, I'm going to then actually now hand it off to Paras, who will tell you about our unique approach to dissecting a question. So Paras, you want to take over?
Sure, thank you, Dr. Lee. So like Dr. Lee said, we're going to kind of walk you through how we recommend dissecting questions. And there's a lot of different approaches to these board questions. So we're going to kind of show you the one that we like to use in our RX coaching program. If you haven't heard of RX Coach, like Dr. Lee said, it's our tutoring initiative, and we'll talk more about that later on. But let's talk about our 7-step approach to questions. So we're going to go over those steps now, and then we'll do some questions together using it so that you can become familiar with how to use it. So the first step is to cover up the answer choices. So you can use a Post-it note, some paper, your hand, whatever you need to cover up those answer choices. The reason we do this is we think we don't want you to become preoccupied with the answer choices and have those choices guide your thinking. So we want you to start thinking just on your own. On top of that, it helps students from becoming overwhelmed or becoming confused. So now we'll move to the next slide, and we'll move on to step number 2. At this point, we will read the last sentence first, or what is called the lead-in. And as we do that, we will highlight and make note of what we think is important. We do this so that we know what we need to look for as we're reading that vignette. And with any luck, this will help us avoid having to reread that question and waste precious time. So now we'll move on to the next slide, step number 3. For this, we want you to think about how many steps is this question going to require to get to the correct answer. So the USMLE can have 1-step questions, 2-step, 3-step, and what does that mean? Well, let me give you an example. If a question is asking for a diagnosis, then that's a simple 1-step question. If a question is asking how to treat the condition, that requires 2 steps, finding the diagnosis and then identifying the treatment. If it asks what is the mechanism of action of a drug used to treat the condition, well then we need to know the diagnosis, we need to know the treatment, and we need to know the mechanism of action. So that's a 3-step question. Like I said, don't worry too much about remembering this just now. We're actually going to use this methodology and dissect some questions together. But before we move on, let's talk a little bit more about this step. So this step allows you to have a clear thought process as you approach the question. So by knowing how many steps it'll take, you can avoid rereading that question, and will also help you identify relevant clues in the vignette. So now we'll move on to the next slide, step number 4. For this step, we will read the question 1 sentence at a time. And after each sentence, we will highlight and make note of what we think is important, while simultaneously thinking through what we should take away from each sentence. So this will help us remain consistent with the question approach and our thought process, and we can keep that thought process organized. It'll also help us avoid having to reread the question, which, as you can tell, is a thing we've mentioned a few times already. So now let's move on to the next step, which is step number 5. So once we've read the entire question, we're going to reread that last sentence or the lead-in. At this point, we want you to start thinking of potential answer choices and trying to narrow those down in your mind. So let your brain start to work at this point. Now we'll move on to the next slide, which is step number 6. And this is the easy step. This is the one where we uncover those answer choices that we had been covering. And now we'll move on to the next slide, step number 7. For this step, we'll start at the last answer choice and work our way up. We do this to make sure that students are looking at all of the answer choices before picking an answer, and you're not getting distracted by an answer choice which you think is correct but may actually be incorrect. So we start at the bottom and we start at the last answer choice and we work our way up. And then we cross out those choices that don't fit with what we had been thinking. Hopefully you'll find an answer choice that fits what you were thinking originally, or better yet, you find that same exact answer, and then you can select that answer and move on to the next question. So now that we've gone over our approach to questions, let's do some of these communication style questions together. So we'll move on to question number 1. So for this, we'll start with step number 1, which is to cover up those answer choices, which we've already gone ahead and done for you. So now we'll move on to step number 2, and that's reading that last sentence first. Which of the following is the most appropriate response by the physician? So in that, you would go ahead and highlight what you think is important in that lead-in question. So now we'll move on to step number 3 and figure out how many steps this question requires. By looking at this is probably a 1-step question. I think we need to figure out the scenario in the vignette and then pick the best response. So maybe a 1-step question. So we'll move on to step number 4 and read that question 1 sentence at a time. We recommend you pause briefly after each sentence to highlight if needed and kind of keep your thought process organized. So you can do things such as asking yourself, what is important in this sentence? Why is this sentence there? For today's purposes, I'll pause for a few seconds after each sentence so you can gather your thoughts at home. A 22-year-old patient who is transitioning from male to female comes to the physician because of symptoms of viral gastritis. On entering the room, the physician addresses the patient as Thomas, as the name on the patient's chart indicates. The patient appears mildly annoyed and corrects the physician and says that she now uses the name Evelyn. So now that we've done that step, let's move on to step number 5 and reread that last lead-in question. Which of the following is the most appropriate response by the physician? So I want you guys at home to take a second to gather your thoughts on what you think a good response to that would be. And now we'll move on to step number 6, and we will uncover those answer choices. So we'll show them to you now. And now we'll move on to step number 7, and for this, we want you to start at answer choice E, and we want you to work your way up. So we'll give you all a few seconds to take a look at all those different answer choices, starting from E and working your way up to D, seeing if any of those sound correct or similar to what you were thinking. And as you can tell, this is a really good communications question, a very good example of what you can expect to see. So now we'll go ahead and open up the poll.
Yeah, and so I'm gonna, before I open the poll, why don't you go ahead and lock down an answer in your mind, because unfortunately the poll doesn't allow us to list the entire answer in there, so you only get part of it. So give you a couple seconds and then I'll open up the poll. All right, I'm gonna be opening up the poll now. And it'll be obviously A through E. All right, launching the poll. And again, choose the best answer. All right, this will stay open for 30-40 seconds. It does, there's many of you folks out there, hundreds of you folks, so it's going to take a couple of seconds to collate all the responses. And then we'll reflect back to you. This will be a very interesting discussion just based on the responses that's coming in.
And then I'll go ahead and just read those answer choices one more time. Answer choice E, I'm sorry, we have your real name in the chart. Let me see if I can pull up the answer choices.
Yeah, E is, I'm sorry, we have your real name. Go ahead, Paras.
Oh yeah, sorry, I was just trying to find
Well,
all the answers.
It looks like 3 folks that almost everybody has answered anyway.
Oh,
so
perfect. Okay.
Let's go ahead and close this. We're already up at 76%. So I'm going to close this and I'm going to share it. And roughly half of you folks went for D. I'm sorry, your preferred name does not appear correctly in your chart. But there's a fair number of folks who also went for A and E. All right. So I'm going to go ahead, hide this so we can get back here and get to the answer, and it is actually D. I'm sorry, your preferred name does not appear correctly in the chart. How would you like to be addressed in the future? There you go.
Thank you, Dr. Lee. So yes, answer choice D is the best answer in this question. The information in the chart was not up to date, and the patient they mentioned was mildly annoyed about this. So answer choice D is a good answer because it's appropriately apologetic, and it seeks to remedy the issue. It seeks to remedy that issue for future encounters. It's polite. It doesn't use judgmental language. And so overall, D is the best answer choice, like many of you selected. But let's also talk about the other answer choices and why those are incorrect from a communication standpoint. So answer choice E. With this answer, you're saying that their given name is their real name, and that's that can be offensive and dismissive of their gender identity. So saying that their real name is in the chart is kind of a little bit insulting because they prefer to now use that new name. So that would not be the best answer. Answer choice C, that's actually entirely dismissive of the error and also the gender identity. So that's not a very good answer as well. Answer choice B, there's a couple things with that. One, it's not an open-ended question, it's a closed-ended question. And it may leave the patient feeling binary. A binary identity is assigned by someone else. You kind of want to provide them with the opportunity to present their identity in their own words, which is not what answer choice B is doing. So that would not be a great answer as well. Answer choice A, which was the second most highly selected answer, So this is apologetic, which is good, but it doesn't acknowledge how that error is going to be fixed for the future. And so you definitely want to make sure that you're letting the patient know that it's going to be remedied, or you're going to be taking steps to do that. So that's why answer choice D here is the best answer. So now we've gone ahead and we've covered our approach to questions. We've done one question together utilizing our approach. So now we're going to move on to another question and do that together as well. So question number 2. So again, step number 1, we're going to cover up those answer choices, which we've done. Step number 2 is we're going to read that last sentence first. Which of the following answers from the patient most clearly demonstrates that he has legal medical decision-making capacity? And in that, you would go ahead and highlight what you think is the most important in that lead-in question. So now we'll move on to step number 3 and try to figure out how many steps is this question. And I think, again, this is probably a one-step question. We need to figure out from those answer choices which one demonstrates that he has capacity. Now we'll move on to step number 4, and we're going to read that question one sentence at a time. A 28-year-old man is brought to the emergency department from a homeless shelter with a severely frostbitten toe that requires amputation. The earliest that the procedure can be scheduled is the next morning. Given the patient's anxious behavior, the physician is concerned that the patient might leave before being treated. The physician asks the patient if he will remain in the hospital until he can be seen by the surgical team. So now that we've read that question, let's move on to step number 5 and reread that last sentence. Which of the following answers from the patient most clearly demonstrates that he has legal medical decision-making capacity? So I want you guys to all start thinking at home of some potential correct answers, okay? And now we're going to move on to step number 6, and we're going to uncover those answer choices for you. So here are those answer choices, and I'll go ahead and read them out loud also, just so we give you more time to gather your thoughts and come up with the answer choice. So answer choice E, the patient refuses to respond. D, no, 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 no. C, this is my body, it's mine, and I won't have you remove my toes. I don't care how bad the frostbite is or if I'm wrong. Answer choice B, the man knows. The man knows, I can hear him, and he's telling me to do this, so I know this is the way to go. Cut it off. And lastly, answer choice A. No, my toe is always like this. It's not a big deal. I'm leaving. So we'll give you all a couple more seconds to gather your thoughts.
All right, I'm going to go ahead and open the poll so you can lock in your answer here. And here we go. Please provide an answer. Got about 20% of you who have voted. So we'll wait at least till 2/3 have cast a vote. Keep it coming. Remember another thing about the USMLE, there is no penalty for guessing. So, try to get it down to what you think are the most plausible choices, then guess from among those. All right, we're at 70%, so looks like we got plenty of data. Let me go ahead and close the poll and then share the responses here. So we see that roughly 75% have gone for C, this is my body. But then there's several folks have already went for A, which is no, my toe is always like this. And a few have gone for B, the man knows. Go ahead and take it off. So let me go ahead and hide that. And then let's get back to the presentation. And the answer is C, this is my body. It's mine, and I won't have you remove my toe. I don't care how bad the frostbite is or if I'm wrong. Okay, so a lot of you guys got that. Go ahead, Bryce.
All right, thank you, Dr. Lee. Yep, so that is a correct answer. Nice job, you guys. So there's a few things that kind of some certain criteria for you to have legal medical decision-making capacity. So one, does the patient clearly communicate a choice? Two, do they understand the medical information that frostbite requires the removal of the toe? Do they demonstrate an appreciation of the situation and its consequences? And are they able to provide a reason for that choice? Okay, so with answer choice C, they're doing that. They clearly communicated a choice. I'm not going to have the toe removed. They understand relevant medical information. They understand the consequences of frostbite, and they're able to provide a reason. And in this case, this is my body, it's mine. So that's why answer choice C is the best answer here. Let's talk about the other ones briefly as well. So answer choice E, the patient isn't communicating an answer choice, so that's not the best answer choice. Answer choice D, although the patient's making it clear of their decision, they're not providing a reason in that answer choice that would allow us to determine if they have decision-making capacity. Answer choice B, so this actually is telling us that the patient doesn't understand the situation and the consequences. And furthermore, he may actually have some active psychosis going on. So in that case, there's actually question whether he does have decision-making capacity at this point. And lastly, answer choice A, which I think was the second most highly selected answer. So this patient is making a clear choice that I'm leaving, but it's also clear that the patient doesn't grasp the consequence of that necrotic injury. And if they can't understand information relevant to their decision, then they may not have that decision-making capacity. So between C and A, answer choice C is a better answer and the correct answer in this question. So great job with this question. You guys did really well. And then now we're going to go ahead and move on to question number 3, which is another communication question, and we'll use our approach together. Hopefully you guys are starting to get the hang of these 7 steps. So once again, step number 1, going to go ahead and cover up those answer choices, which we did. Step number 2, we're going to read that last sentence first. Which of the following is the most appropriate response by this physician? Okay, now we'll move on to step number 3, figure out how many steps this question is. And I think probably, again, a one-step question. We're going to be given a scenario. We need to come up with a good response. Now we'll move on to step number 4, and we're going to read that question one sentence at a time. A 33-year-old man comes to a primary care physician to establish care. The patient has a history of liver transplantation and hypertension. He is recently divorced and does not have children. He also recently lost his job. He does not smoke or use illicit drugs, but says he drinks a 6-pack of beer daily to help cope with stress. So now we'll move on to step number 5 and reread that last sentence. Which of the following is the most appropriate response by the physician? So I'm going to give you guys a second. Start thinking of responses that would be appropriate to what's going on in that scenario. Okay. And now we're going to go ahead and move on to step number 6. We're going to uncover those answer choices. So we have 5 answer choices, and we're going to start at the bottom and work our way up. We're going to give you a few seconds to look at these, and I'm actually going to read these out loud just so everyone has enough time to do that. So answer choice E. You have had a liver transplant. If you don't cut down on alcohol, you may need a second transplant, and I'm not sure the transplant committee will accept your application. Answer choice D. If you don't change your drinking habits soon, I am sorry to say that there is not much I can do to help you. Answer choice C. I would like to discuss your alcohol intake with you. Do you need a drink in the morning to get your day started? Answer choice B. Given your liver transplant, how do you feel about the alcohol that you are consuming? Answer choice A. Do you think alcohol is the reason for your divorce, and do you feel guilty for that? So we have 5 answer choices there. We'll give you all a couple more seconds to think about your answer choice and lock those in.
All right, I'm going to go ahead and open the poll here. All right, go ahead and give us an answer. How would you respond to this patient? All righty. Looks like we've got about 20%. 30%. I think this will be a very interesting discussion once we get all the answers in. 60%. A couple more votes. Lock them in. No penalty for guessing. All right, we're at 73%. Okay, 75. Good enough. Good enough. Right, I'm going to close the poll here. I'm going to share the response here, and actually a wide spread here. 46% said C. I would like to discuss the alcohol intake. The second most popular response was B, giving your transplant. How do you feel about your drinking? Then followed by E, you've had a liver transplant. You don't cut down, you might need another one. And then a couple people, did also went for A and D as well too. So really a wide variety of responses. So this will be very interesting. Let's go ahead and hide the responses, get back to the presentation, reveal the answer, which is indeed C. I would like to discuss your alcohol intake with you. Do you feel like you need to drink it in the morning to get your day started? All right, Ross, let's walk through this question with the group.
Absolutely. Nice job, guys. So this is a correct answer. So this patient is experiencing a great deal of personal stress, and they said he's drinking a 6-pack of beer daily. So that level of alcohol use really should be raising concern for alcohol use disorder, and is especially worrying given his history of a liver transplant. So the response, that's the correct answer, answer choice C, that brings up the topic of alcohol use in a non-judgmental way. I would like to discuss your alcohol intake with you. It's non-judgmental. And then it leads into a question that's part of the CAGE questionnaire, which is a screening tool used to assess patients for alcohol use disorder. So do they feel the need to cut down on their drinking? That's C, cut down. A is for annoyed. Are their friends annoyed by drinking habits? G, guilty. Do you feel guilty for drinking? And E, eye opener. Do you need a drink first thing in the morning as an eye opener? So that's the CAGE questionnaire. So that's why answer choice B is a good answer choice for this question. But let's also walk through some of the other answer choices that were selected. Answer choice E. So, we mentioned that the alcohol use is concerning given his liver transplant, but it would be inappropriate to imply that he'll need a second one, and also suggest that he's not likely to be approved for one. So it's a little bit too harsh and a little bit inappropriate language. Answer choice D. So this gives the patient a deadline, and you're giving the patient an ultimatum, which is not the proper way to deal with such a sensitive issue. So you have to be a little bit careful about that. Answer choice B. I believe this was the second most highly selected answer. So, it is correct that you want to discuss the patient's alcohol use and their amount of daily alcohol use. But this isn't necessarily the best way to go about it. It kind of makes the patient feel guilty and thus less willing to openly discuss their alcohol use with you. You don't want them to feel guilty about that. So that's kind of that subtle clue there that answer choice B is not the best answer in this question. And then lastly, answer choice A. So, talking about this and whether the patient feels guilty is kind of judgmental, as you can tell, and it's likely to offend the patient. So not a good answer choice there as well. So in this case, going with the most non-judgmental answer while also getting some more information, not being judgmental, not causing the patient to feel guilty is the correct answer, and that's answer choice C. Overall, you guys did a really good job with these communications questions, and I'll hand it back to you, Dr. Lee.
Great, fantastic. So let's wrap it up here, with regards to the question dissection strategies that Paras so elegantly showed you, right? So as you can see, you need to have a standardized approach, right? We have this multi-step approach that Paras walked you through, and this is also the exact methodology that we teach in our RX Coach program to get you into a standard algorithm for breaking down and answering a question. When you are when you're trying to reason things through, you want to make sure you take advantage of everything that's provided to you. You saw how Paras, walk through, pause, analyze each part of the case, in solving for the question, and also recognize that a lot of questions are created to test multiple related topics. Again, you typically see this as multi-step questions. Here, we think that initially a lot of the communications questions concepts are going to be single-step questions, obviously, but in the future, there may be a situation where you have to derive the diagnosis, and depending on the diagnosis, that may impact the communications, the ethics, the legal issues, the medical legal issues in terms of how you respond, to the patient. So, keep all of these things in mind. All right, and to again wrap it up with regards to study advice, these are some of the things that we hear students and international medical graduates talk about all the time. That help them get through the step one and do well. One is establish a study schedule and stick with it. Number two, actually this is a little outdated. You want to actually integrate your learning, and so you need to try to pull all the concepts together, related concepts together, so you can you feel more comfortable tackling these second order and third order questions, right, with regards to hey, how does that diagnosis lead to you figuring out what the mechanism of disease is, because that's what they're actually asking about. There are certain crammable subjects like metabolic pathways, bugs and drugs, that if you have flexibility in your study schedule, you tend to put more of those towards the end, because that's where a little cramming doesn't really hurt you, right? And then also focus on what you've learned before, because that's what easier to relearn, in addition to what various texts, including first aid, will identify as high yield. Next, make sure you don't overschedule. Make sure you get time in your preparation, so that you can spend time with friends, loved ones, significant others, get some exercise and so forth. Even if you're in your dedicated study time, make sure you take off at least a day a week, where you can catch up with being a real human being, or at least just minimize and don't go too hard that day, right? And then in the front of first aid, right after all the acknowledgments and so forth, we have a whole checklist about how you can be deliberate in your planning, how you can stay relaxed and grounded in your preparation, especially for those of you that are preparing a couple months or further ahead for the exam. All righty. All right, so as I mentioned, we have the RX Coach program by the same folks behind first aid, myself, right? And you can get it at rxcoach.com. And at rxcoach.com, you can get a 160 question assessment. With our coaches, you get personalized study plans. We have a very customized one-on-one approach with our tutors, who are all very well trained and all certified to teach and tutor and coach. And as part of it, you also get access to RX 360 program that includes the question banks, the videos, the flashcards, digital first aid, and the bricks. Students have outstanding outcomes, can gain anywhere between 30 to 70 points on their step one scores. So check this out as a possible resource. I'll go to the website here. You can go to rxcoach.com. You can learn more about it. you can learn about what's in the program, the various packages that are offered, and then you can also sign up for a free consultation, and just fill this out. Takes 5 seconds to do, and then one of our Rx coaches will reach out to you to schedule that consultation and find out how they can help you. All right.